Late Night Health continues with our contributor, Paul Corona. He's the author of Healing the Mind and Body, and we're talking about bipolar disorder, bipolar disease. Dr. Paul, we were just talking about if I have it, and everybody around me and my family, my friends know that I have a problem, but I don't recognize it, how can you treat me? That's got to be very difficult.
It's very difficult to get compliance with someone like that. I hopefully try to convince them that they have it. It's just like someone with alcoholism, who doesn't think it's a problem. How do you treat something you don't recognize? So the patient has to recognize that there's a problem that needs to be treated, and if that recognition is not there, it makes the treatment much more difficult.
But you can be a functional alcoholic. You can
Absolutely.
go to work. You can drive a car. You probably shouldn't. You can work. You can have a life. You're just drinking an awful lot of alcohol, and it eventually, changes what your life. But you're functioning in the meantime.
Yeah, but bipolar disorder too. Most people can function fairly well. They may have a lot of problems in their life, but they can often function. So that's the problem is that, and as you say, it functioned very well. I mean, take the case of President Lincoln and some of these other people who actually do very well, but they could do a lot better if they get treated. Because the problem is with bipolar disorder, when you're in the mania, you irritate people, and when you're depressed, it's hard to function. So it causes a lot of chaotic functioning in life, for sure.
Reading the chapter that you have, chapter 11 in book number 1, The Ups and Downs of Bipolar Disorder, I came across psychosomatic complaints, and I was curious about that. In other words, people with bipolar think their elbow hurts or their head hurts or whatever?
Yeah, just like with depression. I mean, with bipolar disorder, everything is kind of more extreme than with regular depression. The psychosomatic symptoms are worse, addictions are worse, addictive behaviors are worse, risky behaviors, speeding, gambling, sexual behaviors, being hypersexual. Everything's just at a more extreme state of than with milder forms of depression.
So I'm trying to organize it in my thoughts. So you want more. I mean, for example, sex. You want more sex all the time.
Right.
But you might be more sensitive or feel that you have some kind of physical ailment. Is it usually a physical ailment or a mental ailment that...
Both.
Ah.
Yeah.
So what would the mental ailment be that psychosomatically, brought about?
Well, just not so much, just the anxiety, extreme anxiety, the panic, everything in bipolar disorder is just more extreme than with regular anxiety or regular depression. Got
it. And wrapping up this topic, grandiose thinking. I mean, I'm the king of the world and everybody should listen to me. I mean,
right.
They should.
Grandiose thinking leading to, grandiose thinking can also be very paranoid thinking that, people are after me, I'm speaking directly to God, I'm speaking to the angels, they're directing my thoughts. Hyper-religious states, are common in bipolar disorder. Or grandiose thinking, meaning I'm going to get rich quick and getting into schemes and things that can, lose a lot of money too.
Oh wow, they buy stuff. They want to be rich. They want to be famous. They want wealth, fame, and power.
Right. Exactly.
Right. Dr. Paul, thank you very much for joining us as you have been. We appreciate it. You are the author of Healing the Mind and Body. Dr. Paul D. Corona has been our guest. He is our regular contributor here on Late Night Health, and we really appreciate his time. Thank you.
Thanks, Mark. Thanks, Carl.
Okay. Coming up next, in our next hour, we're going to be spending some time with Clint DeWitt, and we're going to ask him, are supplements really necessary, or do they just create expensive pee? That's coming up as Late Night Health continues.